Hello, my name is Mario. I'm gonna perform how to insert NG tube. All right. So I go into my patient room. Hey, Mr. I'm gonna call him Andy. Hey, Mr. Andy. My name is Mario. I'll be your nurse for tonight. Okay. The doctor has put in an NG tube order. Okay. He said okay. So I look at my, for us we have Epic. Looked at the orders. I do confirm that the doctor wants a NG tube placement. Go back to my patient, look at his armband. All right, Mr. Andy, can you tell me your name and your date of birth? He tell me his name, date of birth, confirmed it. All right, Mr. Andy. So like I said, we're gonna do NG tubing. It's just a tube that goes from your nose all the way down to your stomach. You failed the swallow test study, so we're gonna give you your medicine and your food through it. Okay? Any questions? He says no. Do you give us permission? He said yes. All right, Mr. Andy. So I'm gonna go ahead and put you in that high Fowler position. All right, let me go wash my hands. I'll wash my hands. All right, let me down on some gloves. All right, I got my gloves on. All right, Mr. Andy, so I got a cup of ice with me as well, okay? And just to mainly help you, when the NG2 goes down through your nose, it just kind of helps with the whole process, okay? All right, first let me look at your nerves, okay? I don't see no obstruction, all right. All right, so from here, I got measured, okay? So in order to make sure it's in the right place. Pretty much it's kind of like the stopping point. So you're gonna measure from the end of the NG tube, from the tip of his nose to his ear, okay? And then from his ear, that piece right here, you're gonna go all the way down to the xiphoid process, that middle part of the chest, okay? And for Mr. Andrew, we're going to say it's at 40. I like to grab a permanent marker and then mark it at 40. You can do tape as well. But I like to use a permanent marker just so when they, if they do stay here for a long time, we can, if they do move it, I kind of tell because I don't see that marking point where I left it at. All right, Mr. Andy, so I know where to stop at now. We got you in the right position. Let's go ahead and we're gonna lube it up, okay? About 3 inches. I'll place my hand, lube it up, okay? And so from here, we're gonna go, so we looked at both the nares, we didn't see no obstruction. I'm gonna use the left nair. All right, Mr. Andy, I'm gonna tell you bear down, okay? All right, got you in high Fowler position, I got you a cup of ice. You ready? You said yes. I said, all right. So lubed up and ready, we go in. You already got it measured, and I know where to stop at. We go in, and tell him bear down, swallow, swallow. We give him a cup of, a spoon of ice. Tell him swallow, swallow, swallow. If he starts to cough, we're gonna, tell him open wide, look at his mouth, make sure it's not coiled up at the back of his mouth, or in his throat. We don't see nothing like, all right, you keep on going, you continue the whole process about giving chips of ice, tell him swallow all the way until you reach that mark you made. If it's with a permanent marker or a piece of tape, whatever it is, wherever you know where to stop at. So you keep on going all the way down until you get to that point, okay? For me, it was 40. You get some tape. You got the tape. You'll secure with tape, go under and over. And then until you get into, you can do as much tape as you want, as long as you know it's nice and secure, where the patient won't pull it, and then, because it does happen, especially when they're at night when they're sleeping. All right, so we taped it, secured at the place where we want it to be. Okay, so from here, 2 ways where you can confirm placement. You get your syringe, you aspirate it, get some of that gastric content, get your little cup, throw that in there, a little pH strip, make sure we're in the right place. That's one area, that's one way. Second one, which we do at my place, is the place I work at, so we go ahead and get a chest x-ray. We call x-ray and say, hey, can you go ahead and do a imaging from a patient, chest x-ray, just to confirm placement for his NG tube. And they're gonna say, yeah, okay. So they So you did the call, and then while you're waiting for imaging to get done, go ahead and clamp off the end of the NG tube. Okay, go ahead and clamp that off. Tell the patient don't pull on it, because if you pull on it, and it's gonna come right on out, and we have to do it all over again. All right, you place it somewhere behind them, so they won't pull on it. Probably put like a pillow, something that were in lines where so they won't pull on it. So, all right, Mr. Andy. So I'll be back. Go ahead and take off my gloves. Perform hand hygiene. Patient has no complaints about the NG tube, and of course they're gonna have some discomfort. But as long as they're not coughing nonstop, tell them that that's you're gonna have some discomfort with that NG tube down your mouth. But all you need is put up your safeties or wear safety precautions you need. You gotta wash your hands. All right, you step out, go into your charting, chart the size of the NG tube, which for us was at 16 French. The description, the gastric content, and then of course we already clamped it off before you left, unless the doctor wanted you to put them on suction, depending on the order. It could be place the patient on suction, or have the patient on continuous feeding, or just simply go ahead and clamp it off. I mean, that's the main thing we have to do, because you can't start anything until you confirm placement. So yeah, after you record everything, inform the doctor, and after that, confirm placement, you can start feeding or give medication once you confirm placement. And that wraps it up.